Book your wedding day with us. Salon DNA 415-956-1909.
Hello, I'm Claudia Iseman, and welcome to California Up Now. This show is dedicated to the issues and the people that make our Golden State great. Today we're discussing PrEP, or Truvada, the latest drug in HIV prevention. Joining us now to talk more about PrEP is Pierre Cedric Crouch. He's director of the Nursing Foundation in San Francisco AIDS Foundation. Thanks so much for coming in this morning.
Thank you for having me.
Sure. Tell me, what is PrEP? It goes by kind of two different names, PrEP and Truvada. Explain it to us.
So PrEP is the concept. It stands for pre-exposure prophylaxis, and it's the idea of taking a medication or pill every day to prevent HIV infection. Currently, right now, we only have one medication that's used for this, and it's called Truvada. And what we know is when you take this pill every day, it greatly reduces your chance of getting HIV.
Okay, and so every day you take the pill, and is it sort of in combination with condoms, or because it's a little confusing, sometimes you use it for prevention and those who do have HIV use it also. Can you speak to that a little?
Yeah, so it's a medication that's been traditionally used to treat people who have HIV. Though HIV positive people, they take other drugs. They take a whole cocktail of drugs to treat their HIV. And this drug is just part of that regimen. And it's also part of your own sexual health plan for what you need to do to stay healthy. And the idea behind PrEP is that it gives people additional tools to take care of themselves. Traditionally, we've only had messages around using condoms as the only solution to protect yourself. And we know over time that condoms have not been a very effective tool. People really struggle using them. So this is really giving people an extra option to actually add into their sexual health plan so they can take care of themselves.
Okay, well, we have been talking to other people, and the CDC recommends that PrEP users need to see his or her doctor every 3 to 4 months. Our colleague, Lisa Martins, actually spoke to Damon L. Jacobs, and he's an advocate and psychotherapist from New York City.
In HIV positive individuals who had used tenofovir in different HIV treatment regimens, they saw that there was a very small, but there was an impact for some people on their kidneys when they used tenofovir on a regular basis. So the question was, if an HIV negative person is using tenofovir inside Truvada on a daily basis, would his or her kidney functioning be impacted? And so the CDC asked doctors, please screen this. We need to know this. We need to make sure that your patients are not getting sick from using Truvada on a regular basis. So most people who are using Truvada as PrEP are expected to see their doctor every 3 to 4 months or so to see that they're doing fine, that their kidneys are working fine, that they are not carrying any other STIs, that they're still HIV negative. That is part of the protocol that's expected. Now, doctors can follow those protocols or not. That's up to their discretion.
And what's your reaction to that?
Well, it's actually true. We actually do see that happen in the community. And a lot of it has to do with PrEP being so new and novel that it's not something that's taught in medical schools or nursing schools. So a lot of times people will encounter professionals who really don't know how to actually appropriately deliver it. They'll start off and they'll write the prescription to take care of the client, but then they don't necessarily know what needs to be done to follow up with them. The current recommendation is for them to be seen every 3 months for testing. That is what we do in our clinic, but it does happen where people actually do fall through the cracks and don't get the appropriate testing and screening that goes in conjunction with being on PrEP.
Okay, let's bring it on home here to California. California and San Francisco lead the way when it comes to the number of people taking PrEP. Why is that?
Well, I think a lot of it has to do with HIV having hit San Francisco so hard in the early days. Back in the 90s, there were times where you had about 6 of your friends who were dying HIV every day, and before the medications came out. So there was a lot of hurt in our community from that. So when there was an option to actually help prevent HIV from happening, I think the city actually really embraced it. The reason our clinic is so successful is that we have so much support from the city to actually do our work, and we have a lot of activists who are actually interested in protecting our community. And with the combination of the support and that activism, we've actually been able to move forward in ways that other places have not been able to do so.
And tell us the name of your clinic.
It's a Magnet. It's at Strut, and it's under the San Francisco AIDS Foundation.
Great. All right. Well, Damon also talks about women using PrEP. Let's listen to what he has to say about that.
The reasons why PrEP is not as high in women as it is in men, again, I think are complex. We know that women make up 19% of new HIV infections in the United States annually, but right now, according to Gilead, only make up 11% of people that are using PrEP in the United States. So why is that? I think for a lot of women, first of all, they don't perceive themselves at risk for HIV. Once again, people don't know about PrEP. So a lot of men and women all over the US know nothing about PrEP. The CDC says 1 in 3 doctors still know nothing about PrEP. So these doctors aren't learning about PrEP and they're not educating their patients accordingly. And the word simply isn't getting out.
And so what's your reaction to that? Women and PrEP.
I actually agree with Damon. I think women in the U.S. aren't often told that they actually have a risk for HIV. Now, not all women do. Certain women do. And that whole perception of risk really dictates what you do for your health and how you actually take care of yourself. And it also depends on the messaging you also get from your provider. So if you're not getting the education from your provider, you will never find out that you actually have a risk for HIV. And you might actually fall through the cracks and not actually be offered treatments that could potentially save your life.
All right. One thing that you talked about earlier was how PrEP affects people's lifestyles and the community. Talk about that.
Well, one of the very humbling things about PrEP that I've learned as a practitioner has just been to realize how much of an impact it's had on our community. When the clients are coming back and seeing us for their follow-up visits, you end up learning about how much trauma has happened in our community around HIV. Young gay men are often grow up and they're told, oh, you're gay, you're going to get HIV, you're going to die. And sex is something to be afraid of and fear. And when they come back into our clinic and actually had sex for the first time in their lives without fear of HIV, they actually have a little bit of a breakdown. We've had people cry about it. And you really realize there is a whole lot of trauma that we actually hold as a community that PrEP is actually liberating. We're no longer separating out camps of people who are positive and negative. We're actually all living together, being equal with each other. And that's been just an incredibly humbling experience. And I'm looking forward to see how much more our community is able to grow with using PrEP.
If somebody has a question about PrEP and they want to know more about it, what do you suggest?
So we have a website called prepfacts.com, and they can go on and learn a lot about PrEP, and there's also a link to actually ask questions. And there's also another amazing website that's pleaseprepme.org, and actually helps you find providers who will prescribe and offer you PrEP if you're looking for it in your area.
Great. Well, thanks, Pierre Cedric, so much for joining us this morning.
Thank you.
You're welcome. And you can join us live on Facebook, write a comment, ask questions, or send us an email at tips@newsupnow.com. Thanks for watching. We'll see you next week.